Let's start with it. It's 11:30.
Yes, ma'am. Every time you eat is an opportunity to nourish your body. Good morning, Honorable Principal Madam, our respected teachers, and our worthy guests.
Good morning,
I,
ma'am.
Mus- I, Muskan Khanna of BSc Clinical Nutrition and Dietetics, Semester 6, welcome you all in today's lecture on the behalf of my whole class and department. I would like to thank you all for appreciating our previous lectures. We are grateful for such an appreciating response. Today, we are going to have two lectures, so let's welcome our first presenter, Kiradeep Kaur, who is going to present on the topic calcium deficiency. Before she starts, I would like to request everyone to please switch off your mics and videos. If you have any questions related to the topic, please put it in the chat box and we can take them later. Over to you, Kirat.
Good morning, everyone. I am Kirti Kaur from BSc Home Science 6th semester. Today, I am going to discuss on the topic calcium deficiency. Calcium deficiency. What is calcium deficiency? It is a condition in which the body has an inadequate amount of calcium. There are two types of calcium deficiency: dietary calcium deficiency and hypocalcemia, means low level of calcium in blood. Dietary calcium deficiency. It is a condition in which there is an inadequate calcium intake, which can lead to depleted calcium store in the bones, thinning and weakening of the bones, and osteoporosis. Osteoporosis is a medical condition in which the bones become brittle and weak. Hypocalcemia. Hypocalcemia is a low level of calcium in blood. It can occur from taking medication, medical treatment, disease processes, and infection. Risk factors for calcium deficiency: poor calcium intake, medications that may decrease calcium absorption, dietary intolerance to food rich in calcium, hormonal changes, especially in women, and genetic factors. Calcium deficiency can cause weak nails, slower hair growth, thin skin, dental changes, cataract, alteration in brains, and osteoporosis. Symptoms and consequences: tooth decay, weak bones, easy fractures, brittle nails, joint pain, rickets, tingling and numbness in upper and lower extremities, osteoporosis, brittle bones, permanent disability, inability to walk, malabsorption syndrome, muscle spasm, fatigue, memory loss, and frequent illness. Who need more calcium? Infants, children, and adolescents, pregnant women, old age. In addition, women who have reached menopause also need more calcium. The importance of calcium in childhood and adolescence. Calcium is very important for children. Child's body is more capable of absorbing calcium in this age. Childhood, often referred to as the bond forming year, and growth are very rapid. Many problems also occur in children due to calcium deficiency, like teeth deformity, nail weakness, and rickets. Reasons your child need calcium: Healthy bone development. Bones grow rapidly during childhood and adolescence. Poor consumption of calcium supports poor bone density, especially important as children mature into adulthood. Dietary lifestyle. Children who drink soda, energy drinks, or caffeinated beverages observe even less calcium because these substances may interfere with the way the body absorbs and uses calcium. In addition, high level of sugary soda can cause tooth decay. Why is calcium important during pregnancy? Calcium helps strengthen your baby, rapidly developing bones, teeth, boosts muscles, heart and nerve development, vital structure like skeleton. If you don't get enough calcium, you could run into some complications like weakness and weakening of bones. Why old person need more calcium? Calcium help in muscle contraction, nerve conduction, hormone release, blood coagulation, metabolic processes, controlling osteoporosis, fractures, pain functions, and diabetes. It is important that aged people get calcium because at this age bones and teeth are easily get weak, so right amount of calcium is very important. Sources of calcium: milk and milk products, milk, khoya, paneer, powdered milk, yogurt and cheese, nuts and dry fruits, almonds, pistachio nut, dry coconut, dry apricot, kishmish and dates, pulses and vegetables, Bengal gram, rajma, black gram, soya bean, lotus stem and broccoli, leaves, amaranth leaves, radish leaves, fenugreek, carrot leaves, curry leaves and spinach leaves, cereals, ragi, bajra, wheat flour and oatmeal. Vitamin D play a very important role in calcium absorption. Calcium and vitamin D work together to maintain healthy bone and teeth. Vitamin D comes from two sources, from sunlight, from diet. We can get vitamin D from sunlight, fatty fish such as cinnamon, tuna, cheese, mushroom, egg yolk, fortified food that often have added vitamin D includes milk and breakfast cereals. My friend Himangi Sharma is going to discuss on vitamin D in detail. How is calcium deficiency treated? Add more calcium to your diet. Do not self-treat by taking lots of calcium supplements. Taking more than the recommended dose without your doctor approval can lead to serious issues like kidney stones. Supplementation may include vitamin D. You should not change or stop taking any medication without first consulting with your licensed healthcare provider. Consuming acquired or increased amount of calcium rich food such as dairy products, green leafy vegetables, and nuts. So, taking proper diet and proper calcium into your diet, you can also take supplements as prescribed by doctors can prevent calcium deficiency. Thank you, everyone.
Thank you, Kirat. Moving on, let's welcome our second presenter, Himangi Sharma, who is going to give a lecture on vitamin D deficiency. Over to you, Himangi.
Good morning to all. I, Himangi Sharma from BSc Home Science 6th semester, today present on vitamin D deficiency. Vitamin D is very important nutrient for our bones. To know more about vitamin D deficiency, let's go down to the presentation. Vitamin D deficiency. What is vitamin D? It is a sunshine vitamin that is most important for our bones. What is vitamin D deficiency? A person suffers from milk allergies or adhere to strict vegan diet, you may be at a risk of vitamin D deficiency. Vitamin D is produced by the body in response to skin being exposed to sunlight. Symptoms. Vitamin D is essentially important vitamin that has powerful effects on several systems throughout your body. Here, some common symptoms are dark skin, getting sick, bone and joint pain, bone loss, hair loss, muscle pain, mood swings, fatigue. Effects. Deficiency of vitamin D leads to inadequate absorption of calcium and phosphorus. It also leads mineralization of bone and tooth structure, rickets, atony, dental health, osteomalacia, and hypervitaminosis D. The first is rickets. It is the softening and weakness of bones in children, usually because of extreme prolonged vitamin D deficiency. Their inherited problems can cause rickets. Symptoms of rickets: delay in growth, pain in spine, thickening of the wrist, thickening of the ankles, bored legs. Second is dental health. In infants and children, there may be delayed and definition malformation of the teeth. Permanent teeth forming in the jaw are subject to decay. Statin. It is generally considered by low calcium muscle twitching cramps. It is result from insufficient absorption of calcium and vitamin D. It is disturbance of the parathyroid gland. Symptoms of tetany: non-severe abdominal pain, chronic diarrhea, muscle pain, tingling in hands or feet, twitching fingers, and in severe, loss of muscle coordination, loss, change in vision, paralysis, seizures, slurred speech, sudden difficulty with memory, thinking, talking, writing, or reading, sudden weakness or numbness on one side. Osteomalacia. It refers to marked softening of bones. It affects older adults, can lead fracture. Symptoms: pain in bones, back pain, leg pain. Hypervitaminosis D. It is rare but potentially serious condition. It occurs when you take too much vitamin D. Intake of too much vitamin D can cause abnormally high level of calcium in blood. Symptoms: dehydration, vomiting, diarrhea, decreased appetite, irritability, constipation, fatigue, muscle weakness, and metastatic calcification of the soft tissues. Food choices. Vitamin D is the only nutrient your body produces when exposed to sunlight. Vitamin D is necessary for absorption of calcium, which plays a key role in maintaining bone strength and skeletal integrity. Egg and egg yolk, mushrooms, oatmeal, seeds, bread, cheese, tofu, cereals, almonds, amaranth, and spinach. Sunlight is also a good source of vitamin D.
Fortified foods like cow milk, soy milk, orange juice, and yogurt. Why calcium is important? Your body needs calcium to build and maintain a strong bone. Over 99% of calcium stored in your bones and teeth. Absorption and excretion. Vitamin D is absorbed along with food fat from intestine and transported through lymph. Bile is essential for absorption. Vitamin D is circulated to a specific protein that transports vitamins in other tissues. हमें सनलाइट से विटामिन डी मिलता है और फूड जो विटामिन रिच होते हैं और सप्लीमेंट से विटामिन डी मिलता है जो विटामिन डी है वो कैल्सिडायोल को हमारे लिवर में कन्वर्ट करता है और कैल्सिट्रोल को हमारी किडनी में इनएक्टिव फॉर्म प्रिवेंशन द बेस्ट वे टू प्रिवेंट विटामिन डी डेफिशिएंसी with eat food that are rich in vitamin D and calcium like fortified foods, whole cereals and grains, green leafy vegetables. Some tips for avoid deficiency include maintain body weight, treating medical condition. Thank you.
Thank you, Himangi. I could see a number of questions in the chat box. Them. The first question by Mandeep Kaur. What does calcium do?
जो कैल्शियम है वो वैसे तो हमारी बोन्स और टीथ को स्ट्रॉन्ग बनाने में बहुत हेल्प करता है और उसके और भी फंक्शंस होते हैं जैसे कि ब्लड सर्कुलेशन में हेल्प करता है और हमारी हार्ट रिदम को भी वो मेंटेन करने में हेल्प करता है
The next question by Gagan Dhillon. Which age group will need more calcium?
Old age people need more vitamin D and calcium because of their weak bones and teeth.
Old age along with children need more calcium. Navpreet wants to ask, how much calcium do we need daily?
डेली रिक्वायरमेंट्स जो है कैल्शियम की वो जैसे कि 19 to 50 इयर्स के जो पीपल्स हैं उनके लिए जो है उनके लिए 2500 मिलीग्राम पर डे होनी चाहिए और अबव के लिए जो है 2000 मिलीग्राम पर डे होनी चाहिए
It should be approximately 2000 milligram.
Yes.
Renu Rana wants to ask, what are the symptoms of lack of calcium?
लैक ऑफ कैल्शियम के बहुत सारे सिम्टम्स होते हैं जैसे कि वीक बोन्स वीक नेल्स जॉइंट पेन मसल स्पेज्म ये सारे सिम्टम्स होते हैं
Manmeet Kaur wants to ask, how bone loss occurs?
जी हम प्रॉपर कैल्शियम ना लें और हम डाइट में भी प्रॉपर कैल्शियम ना इंटेक करें तो हमारी बोन्स जो है वो वीक हो जाती हैं उनको प्रॉपर कैल्शियम नहीं मिलता तो उससे बोन लॉस हो जाती है
Okay. प्लस हम कैफिनेटेड चीजें बहुत खाते हैं या पीते हैं जैसे सोडा हो गया वो लोग कैल्शियम की एब्जॉर्प्शन में कैल्शियम एब्जॉर्प्शन रोक देते हैं Ravneet Kaur wants to ask, what happens if we take too much vitamin D?
When we take too much vitamin D, then it affects our blood pressure, and also cause hypervitaminosis D.
Kiran wants to ask, what are the health benefits of vitamin D?
Okay. It prevents us from cancer. It also reduces risk of osteoporosis and fractures, and it also promotes our strong bones and teeth.
Thank, thank you, Himangi and Kirat, for answering all the questions. Once again, I would like to thank Madam Principal, Madam Sunila Sharma, and Madam Minna Baga for giving us this opportunity. See you all in tomorrow's lecture about importance of breakfast. Thank you and goodbye.